Yeah, of course. And you mentioned, Sophie, previously before we started the podcast about change management and cultural alignment, right? So, could you illustrate us by any example that you might have seen in this new role of yours? Like what works? How does it work and what works
Yeah.
best? And you also mentioned something very interesting that you're measuring it. Any such measures that you actually use in the business enterprise?
Yeah, I'll use a couple of examples. So, most importantly, right now is we are doing the readiness for our EHR implementation. As part of the readiness, even though we are keeping an eye on leveraging best practice and ensuring that we have an enterprise standard in those processes that we're implementing, there is
Mhm.
still the engagement of operations and translations on what is most important to you. Will this help you? Do you think that this workflow complements and meet your respective needs? And so some of the work that we are doing is making sure that there is a laser focus on operational engagement and operational input on their readiness and their understanding and their translation to their respective departments
Mhm.
about that readiness. The other thing relative to culture
Mhm.
and success is we partnered very closely with PeriOp. And
Mhm.
because we are a large organization that grew over mergers and acquisitions, we
Mhm.
don't necessarily have a standard system across the 21 institutions that we have, right? And so some of the challenges that we have is OR throughput. And
Yeah.
think of the OR throughput relative to not only do you have the surgery schedule, the surgeon and the care team availability, but also room logistics and having patients come through the pre-op, the
Mhm.
operations, peri-op, and then so on and so forth. We worked very closely with the operations to understand the problem. We looked at a technology and maybe multiple technology that complemented data that
Mhm.
will help and advise the operations of
Mhm.
how to load balance and pivot throughput in the OR. And that was very much a success story. In essence, we have significant measurable outcomes of how we optimize the room, the schedules in real
Mhm.
time. In real time, out and plan is easily done on paper, but then
Yeah.
as the day goes on, you can imagine sort of the complexity tens and double digit OR rooms and triple digit
Yeah.
workforce with
Yeah.
patients. We were able to very efficiently low balance it and brought joy to the clinicians and the
Yeah.
patient, but also making sure that we really did optimize throughput as an outcome of that. Not that
Yeah.
that was the only goal. And in that sense, you were able to increase volume
Yeah.
and revenue. At the same time, the main goal was to make sure that we brought efficiency and joy back to the surgeons and back to the patient schedules.